In Uganda, 17 mothers and 106 newborns die every day due in part to inadequate government investment in life-saving emergency obstetric and newborn care. In 2011, White Ribbon Alliance Uganda advocated to the government of Uganda to make a commitment to the UN Secretary General's strategy on women's and children's health, also known as Every Woman, Every Child. In response, the government committed to ensuring that by 2015, all Health Center 3s and 4s will provide basic emergency obstetric and newborn care services. Half of Health Center 4s will provide comprehensive emergency obstetric and newborn care services.
We have the policies and the knowledge. What we need is to deliver on our promise to functionalize emergency obstetric and newborn care services. We need to use all the means and opportunities at our disposal to meet our commitments.
Despite the government's commitment, health centers remained understaffed, ill-equipped, and women continued to travel many miles and hours to receive life-saving care. White Ribbon Alliance members and civil society organizations agreed that immediate action was needed to accelerate progress on maternal and newborn health.
There's a mother who came in second stage of labor with the arm prolapse. The doctor was here, but the theater is not functional. We don't have other equipment like catheters and what have you, even other equipment which we could help them. There's no blood transfusion. Power is also on and off. There's no generator which could run the theater.
White Ribbon Alliance Uganda also used the evidence gathered to mobilize citizens to demand accountability for healthcare spending at these facility levels, amplifying this demand and calling upon policymakers both at district and national level to respond to this demand and do so with action.
I, Atim Joy Ogom, the woman member of Parliament for Lira District, have greatly received your humble petition to the Parliament of the Republic of Uganda.
And in 2014, White Ribbon Alliance Uganda launched the Act Now to Save Mothers campaign to hold the government of Uganda to deliver on its commitment. The campaign was launched in the districts of Lira, Kabale, and Mityana.
A quote from Prime Minister Jens Stoltenberg, Norway, that day of birth is the most dangerous day in the life of a woman and her child. The fact that women do not get the care they need during childbirth is the most brutal expression of discrimination against women. To prevent these tragic and unnecessary deaths is not only a humanitarian agency of highest priority, but a key investment for social and economic development. I close quotes.
After 2 years, we have seen encouraging results and impact. White Ribbon Alliance has learned, and there is evidence that it pays off when you support citizens to demand for accountability and also support decision makers and leaders to respond to citizens' demands.
Medical nurses in this hospital take care. They look after you from the time you've come until the time you leave.
Moko Health Center 4 in Kabale is one of the beneficiaries of Act Now to Save Mothers campaign. Dr. Murindwa Alex, who was recruited as a result of the campaign, succeeded in conducting an emergency cesarean section delivery at the unit for the last 3 years.
I've conducted 2 cesarean section deliveries here. The first mother had obstructed labor, whereas the second one of 11th, there was fetal distress. You know, it is very dissatisfying and painful if you see someone who requires an intervention that you are trained and you are competent in doing, but due to some shortages you are not able to do it. I feel so bad to have to refer a mother whom I could work on.
White Ribbon Alliance established and supported community-based monitoring and advocacy teams in the 3 target districts, which strengthened the relationship between communities and policymakers. These efforts resulted in significant improvements in infrastructure, health worker recruitment, and the availability of life-saving commodities. And district officials have commended White Ribbon Alliance for bridging the gap between citizens and policymakers and strengthening the health system to better respond to community needs.
So White Ribbon Alliance is one of the partners in the country that has supported us a lot, especially in the area of advocating for better health services and lobbying for resources.
Along the way, White Ribbon Alliance has learned some lessons.
The key lessons are that the voice of the citizen is very, very critical in holding leaders accountable. When they speak from real experiences. They talk about issues that affect their lives.
I'm grateful the community already know what it is. Previously, they were dying innocently. They didn't know government had got to do certain things for them. But now citizens, the community have also generated their own voices.
This advocacy has come at the right time when we're trying to move into new financing platforms. Uganda is one of the 8 countries to receive funding from the Global Financing Facility. And as I speak now, we are working on the investment case. So some of the groundwork which has been done by White Ribbon Alliance and other CSOs is actually feeding into, in a very timely manner, this proposal we are developing for the Global Financing Facility.
They also brought evidence from the health workers on how frustrated they were with the fact that they could save some children who could not be saved because we could not bring such basic commodities. As a result of that embarrassment, everybody had to start issuing instructions to make sure that things are done right. Also, as a result of that, government has been able to move further to the other partners.
This is the cry for mothers. Let us stand together as one for mothers. Yeah, let us fight together as one for children. Yeah, let us stand together as one for mothers. Yeah, let us fight together as one for children. Yeah, every mother deserves to live, my friend. All the children deserve to live, my friend.